Assalamualaikum and good morning everyone. My name is Ashiqin binti Abdullah. So for my part, I am going to present about treatment for disorder, which is treatment for autism spectrum disorder, focusing on language disorder. So there is currently no one standard treatment for autism spectrum disorder or ASD, but there are many ways to help minimize the symptoms and maximize abilities. So people who have ASD have the best chance of using all of their abilities and skills if they receive appropriate therapies and interventions. So the most effective therapies and intervention are often different for each person. However, most people with ASD respond best to highly structured and specialist programs. In some cases, treatment can greatly reduce symptoms and help people with autism with their daily activities. So there are four therapies that I found for ASD people, especially for language disorder. The first one is speech language therapy. So speech language therapy addresses challenges with language and communication, and this therapy can help people with autism improve their verbal, non-verbal, and social communication. The goal of this therapy is to help the person with ASD to communicate in more useful and functional ways. So a speech therapy program begins with an evaluation by a speech language pathologist to assess the person's communication and strengths and challenges. The goal of SLP are to improving spoken language, learning non-verbal skills such as sign or gesture, or learning to communicate using an alternative method such as picture or technology. So there are several examples that the skills of the speech therapy may work on, which is the first one, strengthening the muscles in the mouth, jaw, and neck, making clear speech sounds, matching emotions with the correct facial expression, understanding body language, responding to questions, matching a picture with its meaning, using a speech app on an iPad to produce the correct word, and then modulating tone of voice. So next treatment is alternative augmentative communication or AAC. AAC is short for augmentative communication and alternative communication. Communication means devices, systems, strategies, and tools that replace or support natural speech are known as augmentative and alternative communication or AAC. So these tools support a person who has difficulties communicating using speech, and AAC also is when you add something to your speech like sign language, pictures, a letterboard, and this can make your message clearer to your listener. So AAC when you are not able to speak or your speech is not understood, in which case you need a different way to communicate. So for autistic children, they can have difficulties in understanding or using spoken language. So some might have a language delay, so communication and language can sometimes be hard for them even after they have tried language development programs. So for some people with autism, they always find that using pictures or technology to communicate is more effective than speaking. That is what we know as alternative augmentative communications. So there are a few examples of the methods that AAC use, which is sign language, pictures exchange communication system, iPads, speech output devices. But there are also different type of AAC, which is no touch and low touch. For no touch, which is gesture and facial expressions, writing, drawing, spelling words by pointing to letters and pointing to photos, pictures, or written word. So for high touch, which is using an app or an iPad or tablet to communicate, and also using computer with a voice, sometimes called a speech generating device. So a person may use different types of AAC because there are many ways that we all communicate. So an AAC system means all of the tools that help autistic people to communicate with other people. So next treatment is early intervention. So, research has shown that intensive behavioral therapy during the toddler or preschool years can significantly improve cognitive and language skills in young children with ASD. So, there are common features of early intervention, which is starting as soon as a child has been diagnosed with ASD and providing focus and challenging learning activities at the proper developmental level for the child for at least 25 hours per week and 12 months per year. And then having small classes to allow each child to have one-on-one time with the therapist or teacher and or small group learning activities. And also having special training for parents and family and encouraging activities that include typically developing children, also measuring and recording each child's progress and adjusting the intervention program as needed. And lastly, providing a high degree of structure, routine, and visual cues such as posted activity schedules and clearly defined boundaries to reduce distraction. Sometimes early intervention program also include family training, speech therapy, hearing impairment services, physical therapy, and nutrition services for autism family. So the last therapy is a pivotal response treatment. So what is pivotal response treatment? Pivotal response treatment or PRT is a behavioral treatment for autism, and this therapy is play based and initiated by the child. So PRT is based on the principle of applied behavior analysis or ABA, and pivotal response treatment is a behavioral intervention aimed to improve social communication skills in individuals with ASD. So PRT focus on supporting pivotal areas of development to help children build the social skills that they need to function well at home, school, or at other place. So PRT therapies target pivotal areas of child development instead of working on specific behavior. So by focusing on that part, PRT produce improvement across other areas of social skills, communication, behavior, and learning. So how does PRT work? So PRT therapists use various strategies to motivate autistic children to talk during play. So for instance, they name a toy that a child shows interest but hand it over when the child requests it by name. So that's how it works. Okay, so I think that's all from my part. Thank you for watching my videos.